One of my followers sent me this post, and I needed to share this with y'all. Doctors at an Ohio hospital propped up a dead patient in a fake alive pose before she was seen by her family, even though she had died during a routine surgery 2 hours earlier, according to a lawsuit. Let's meet the doctor.
My name is Jared Betts. I am an interventional cardiologist here at Adena Regional Medical Center. For me, the most important thing is, connecting with the patient and doing what I can to try to help them and give them the best advice and do what I can to help them in terms of helping them feel better, helping them to live longer, and that's really my number one focus. The reason that I came down here was to help bring services to this community that aren't currently available.
Now that we've heard from Dr. Betts himself, let's hear a little bit more about this story. The fact that this woman had been propped up to seem alive, that's one of the claims from this family, the 65-year-old family. To make matters even worse, the woman had reportedly been in good health. So this happened at the Adena Health System, where that doctor that we just saw, where he practiced. Sources within the hospital said cardiologist Dr. Jared Betts, who had previously faced questions over his credentials, cut an artery during the procedure. Then he thought he had the situation under control. Unfortunately, it wasn't until the patient was taken to the ICU that doctors found she was still bleeding. The patient was then taken for more surgery with Dr. Atik Rahman. According to medical records, she had died during the second procedure. Part of the controversies come from the discrepancies during the time of death. Hospital records said that the date that the patient died at 1, while the death certificate says she died at 3:05 p.m. At 3:05 p.m., the family was brought into the hospital room to make an urgent decision on whether to pull the patient from life support. So they were sitting up here trying to lie to these people. That is what led the family to believe that the patient's body was actually staged to look alive. Loved ones left with questions about why the hospital would stage a fake alive pose when she'd already been dead for 2 hours. The controversy added to the existing controversies surrounding Dr. Betts. There were reportedly more than 31 individuals who came forward with allegations he was faking his credentials. These controversies raised questions about the broader safety and professional standards within Adena's cardiology department. A nurse who chose to remain anonymous suggested the patient might not have needed the procedure in the first place. Yes, y'all, this is a wider problem that needs to be discussed because let's be completely honest, this is where intersectionality, where some people get propped up simply because of their skin color and because they were born with a peen. Let's not act like some people get a certain kind of privilege of authority or power or leadership or skills simply because of how they were born. And if we keep propping up mediocrity simply because of this, if this is what happened, giving him credentials that he didn't deserve, people will continue to be harmed. There was a doctor who was on TikTok and she was speaking here on Instagram as well. That's where I first saw her videos where she was talking about the harms done by male physicians and how women physicians have to swoop in and actually help out. This is something that needs a deeper dive into, because if we allow these people to simply skirt by, whose family member will be harmed unnecessarily next time? Yeah, you guys go ahead and weigh in. This doctor, watch her video. She is sharing what different women have gone through and why, and the things that they experience with male physicians versus female physicians. Watch this video.
When I posted a video early this week sharing the results of our study that just came out showing that patients treated by female surgeons have better outcomes at 90 days and 1 year after surgery than do those who are treated by male surgeons, I truly did not expect the outpouring of stories of harm caused to people by physicians. I want to share some of those stories here because I want to make sure that I at least try to get more eyes on these stories. These are just a few of the thousands of responses left on this video. Couldn't breathe after C-section and male doc diagnosed panic attack. Female doc found it was congestive heart failure from hypervolemia. Male doctor said I had anxiety. Female doctor found out it was pancreatitis and admitted me immediately. I had yellow eyes. Male doctor told me my back pain was stress and anxiety. I in fact had 5 ruptured discs. Male ER doctor told me my headache was menopause. It was a ruptured aneurysm. Male doctor told me I had gas and to take Tums. Female doctor confirmed it was an ovarian cyst rupture. My male primary care doc told me I needed a psychiatrist when I asked for a specialist referral. I was in kidney failure and almost died. Male doctor told me stomach pain was from well water. Female nurses were certain there was more going on. My appendix ruptured an hour later. Male doctor told me I had a mild UTI and didn't take my vital signs. Next day I got rushed to the hospital in an ambulance with sepsis and could have died. Male doctor told me my adult onset asthma was probably in my head. Tests showed I lost 50% lung capacity. 2 times male doctor told me I pulled a muscle. Female doctor listened to me and my concerns, sent me for an ultrasound, and found my DVT that was already thrown. Was in so much back pain I couldn't sit down. ER doctor says not much he can do. No x-ray, nothing. Family doc sent me for urgent CT, broken tailbone. Couldn't walk from all the pain. Male doc signed hospital release papers to send me home. Female gynecologist found my appendix burst, and I had sepsis. Male surgeon told me I had gas pain a few days after surgery. Then a female doctor caught that I had a pulmonary embolism and I was hospitalized. Male surgeon told my sister-in-law her stomach pain was anxiety, I don't know. It was Crohn's. My male doctor told me I was lying about my kidney pain and to just go home. Ended up in the ER not even 24 hours later for a kidney infection. Male doctor said my pain was from the period I wasn't on. Female doctor found out I had a blockage in my intestines. Male doc told my sis her vision issues were from makeup. Female doc found she had uveitis from undiagnosed Crohn's disease. Male doc said my ankle injuries weren't possible from hiking and it was just bruising. Both were fractured. Male doctor told me that my weight loss, 20 pounds in a month, blurry vision, and hyperventilating were mental health related. Female doctor diagnosed me with type 1 diabetes. We could keep going because so many people generously shared their stories. I really hope as many people as possible, especially as many people in healthcare as possible and as many physicians as possible, can see these comments or this video, because I think a lot of times we are unaware of how much harm we are causing. The vast majority of comments on this video are specifically about harms caused by male physicians, but I do want to acknowledge that physicians of all sexes and all genders can certainly cause harm. And we're definitely not going to do any better if we don't realize this is what's happening in healthcare. And to everyone who shared your stories, I am deeply, deeply sorry that our healthcare system has failed you in such disturbing ways. And I hope that you sharing your stories will help us to do better.